Okay, I won't have gloves on, but I'm not on the door.
Hello.
Hello, my name is Janice. I'm your certified nursing assistant today. What is your name?
Miss Harrison.
Miss Harrison, would you like to be called Miss Harrison?
No, I like to be called Betty.
Okay, Betty, I am here to provide you with a partial bed bath and back rub. Is that okay?
Yes, it is.
First thing I want to do is hand you your call light. And then I want to go wash my hands and gather my supplies. Is that all right?
Hurry back.
I will be back. Okay. Will not have your gloves on at this time.
Hello.
You enter, and as you have gathered your equipment, the first thing you want to do is put down what we call chucks. One at the bedside for the skill, and another at the sink. This is when you can finish gathering the remaining of your supplies. You're going to need a towel, a gown, 2 washcloths, the washcloths should be away from each other, one rinse and one wash, one rinse. The gown, towel, your basin, lotion, and soap. All these items should be on a chuck. You have entered the patient's room. The patient has the call light, so the patient is okay, or the resident is okay. You will let her know that you're going out of the room now to finish gathering your supplies, and that is to take the basin to the sink and fill it with water. I will be back, Miss Harrison.
Okay.
I gotta do that one again. I touched it with my hands.
Okay.
Okay.
Come in.
Okay, Miss Harrison, I'm back. Are you ready to start?
Yes.
Okay, I'm back. I'm going to take away your call light. I'm going to close your privacy curtain.
Thank you.
Do we have a timer? I'm going to now raise your bed. raising the bed up to your waist level, always, to prevent strain on your back. You're now letting the patient test the water to see if it's for her liking. Mrs. Harrison, can you please check the water? Sure. Oh, it's perfect. Thank you. You're welcome. You will want to bring your table as close as possible to the bed. You will want now to take your towel and place it underneath the patient's head. Mrs. Harrison, can you lift your head? Sure. With your washcloth, there is no soap to the face for this skill. So you will pick up your washcloth, and the first thing you want to do is make sure your washcloth is folded within 4 so that you can wash each part of the face. You want to start with the outer eye first. You want to start with the lower part, inner to outer. Rotate your washcloth and do the upper lid, inner to outer. Okay? You can put it back into the water and do the same with the other eye, closest to you. Inner to outer. Rotate your washcloth and go inner to outer. That is washing your eyes, the patient eyes. Okay. What you would want to do now is take your towel and dry the same thing as you did with washing, inner to outer. You will want to pat dry your eyes. The next part of the face is the forehead. Again, your washcloth should be in 4 corners. You will want to take the washcloth and begin by going across the forehead once, rotate the washcloth, and do it again. Put your washcloth down. Now you want to dry your forehead. The next part of the face would be your cheeks. Like you're putting on blush, you want to go up the cheeks. From the side furthest from you, rotate your washcloth. You can rotate your washcloth again and do the other with rotation again. Put it down, pat dry. The next part of the face will be the chin. Across. Again, rotate your washcloth. Okay. Put it down. Pat dry. This is where your first application of soap applies. That is to the neck area. So you would take your wash, apply soap, across, rotate, across. Put it down. After you wash, you now must rinse. Cross, rotate, across. Put it down. After rinsing, you must pat dry. Okay. That completes washing your face, the patient's face. Now what you will want to do is, Ms. Harrison, I'm going to take your sheet away a little bit, okay?
Okay.
Okay. You're going to take the towel now from underneath her head. Is it okay if I lift your head a little bit?
Yes.
I'm going to take the towel now and place it underneath one arm. And at the same time, I'm going to take away this gown and I'm going to give you a fresh one, okay?
Thank you.
Okay. You will want to leave the gown underneath the armpit, and instead of reaching over the patient, you're to go around the bed. To take off the other sleeve of the gown. Okay. Leaving it in place. This will permit you to perform washing of one arm as expected with Prometric. This part of the arm is our anterior surface of our arm. This part of the arm is your posterior. So you are instructed to wash an arm first and then the hand, anterior and posterior for both. So this is my wash. You apply soap. And you wash down the arm. You rotate your washcloth and do it again. Okay. You pick the patient's arm up. You're going towards all the way to the armpit, and you're washing up. And again with the rotation, you do it again. You put the arm down. That was wash. You do the same for rinse. Wash down. You can do it again if you like. Then you can rotate your washcloth for the posterior all the way to the armpit and go up. With rotation again, go up. You're going to pat dry the arm. Now I'm going towards the hand and fingers. You're going to wash. Just a little soap. You don't have to get fancy. Okay, washing the hand anterior with rotation of your washcloth posterior. Okay, and in between the fingers with rotation. Put the hand down. You do the same with rinse. Anterior, rotate, posterior, put the hand down, and between the fingers with rotation. And pat dry. And in between the fingers as well, with rotation. You're going to now take the towel. How are you doing, Miss Harrison?
Oh, it feels good.
Okay. You're going to place the towel over the chest, and that will allow you now to bring the gown down towards the feet, but keeping it in place. Okay. You're going to wash. The chest between you and the patient should see it, or the resident should see it. You hold your towel up, and you are going from one side to the other with rotation across the chest. You do the same for rinse. Across the chest, rotate your washcloth. Again, across the chest. You can actually, if you like, to do across the chest and also underneath the breasts all in one. So basically you and the patient will see this, but you will go underneath the breast with rotation. Okay. And pat dry. What you would do now is you would take the new gown and place it on. Okay, Miss Harrison, how are you feeling?
Good.
Always go around the bed. The towel now can go at the vaginal area, and you can finish putting on your gown, clean gown. Having some space so that you can now wash your abdomen. Wash. Cross. Rotate across. Rinse, rotate across. Put it down. Then you want to take your towel and pat dry. Now you can place the gown all the way down. Okay, you want to keep your towel so you can put it on your table. And now you can take away the soiled gown and place it at the foot of the bed. How you doing, Miss Harrison?
Doing good.
Okay, we're almost there. Okay, what you will want to do now is let the patient test the water, okay? Because with this skill, basically, you're going from the front to the back, so the water may be cold. Mrs. Harrison, can you test the water for me? I'm going to give you a nice back rub, okay? Okay. Oh, it's perfect. All right, let's finish up. You want to start by having the patient go onto their side. So you're taking one hand and you're informing Miss Harrison that you're going to come to me a little bit, okay? You have your hand underneath the head and one hand underneath the shoulder, and you move the patient over at the count of 3. Okay, we're gonna do it again in the middle. Lower back and hip. 1, 2, 3, over. Hip and legs. 1, 2, 3, over. That's when you can now instruct the patient that they're going on their side. Are you ready?
Yes.
1, 2, 3. Okay, and you can also let them have their pillow. This is when you're going to place the towel back underneath the back area. Bring your table close and begin with the wash. You're washing downward. How does that feel, Miss Harrison?
Okay.
On each side with rotation, and then in the middle. You're going to do the same thing with rinse from the shoulder downward, shoulder downward, and in the middle with rotation. You're going to pat dry the back. This is when you're going to apply lotion. So you put a little bit of lotion into the palm of your hand. You actually are going to go around the bed and let the patient test the lotion. How is this, Miss Harrison? Is that good?
It's fine.
Okay. So you're coming back around, you warm up the lotion, and you are going to do a heart-shaped motion to place the lotion onto the patient's back. 3 times. 1, 2, and 3. How was that, Miss Harrison?
That was lovely.
Dry off your excess lotion, if you have any. Okay. What you would want to do is give preference to the patient as far as the ties on their gown. Would you like your ties to the back, or would you like it to the side?
To the side, please.
Okay. Okay, at the count of 3, we're going to come back onto your back. 1, 2, 3. Lift your head. Let me get the pillow. Okay, good. Onto your side with your ties is basically, you're going to have the ties right on the side of the neck. Uncross the legs. Let her have her cover back. How was that Miss Harrison?
That was fine.
Okay. Miss Harrison, I have to leave the room, okay? But I will be back. I'm going to hand you your call light. Is that okay?
Yes, thank you.
I'm going to open up your curtains now. I'm going to lower your bed. I will be back. This is when you would take your linen, you will apply a pair of gloves, take your linen to the camper, to the linen basket. Okay. Knock, knock.
Come in.
Then you will take the remaining of your material, put them away. Remember, the patient has their call light, she's fine. You will take your water to the sink. I always encourage one to place your basin onto the chuck so that you can think. Your hands are clean, so you will want to take a paper towel down and turn the water on. This water can go inside the sink. Always rinse your basin 3 times. Set it down on the paper towel so that you will be able to think. You don't need your water anymore, so you can turn your water off. But you need to dry the basin, because water with moist harbors bacteria. You dry it inside and you dry it out 3 times. The state of New York likes the 3-time method. Okay, so your basin is nice and dry. You can take away your equipment at the sink. You can place your basin in the drawer. Knock, knock.
Come in.
You can take away your chuck on the table and your gloves. I will be back, Miss Jones.
Okay.
Go back to the sink. You get it wet and dry. And you can also have gotten this as you emptied the water. You can place this wet and dry onto the chuck, come back with it, and wash off your table. Okay, Mrs. Harrison Jones, you need anything else?
No, I'm good, thank you.
Okay, the patient has their call light. If they wanted to read a magazine, this is what you would do. You look around your room. Is everything done? That's what you're going to be saying to yourself. Then you will go back and wash your hands for 20 seconds. Come back to the patient's room and tell the evaluator, my task is complete. My hands are washed, my task is complete.